Hi, good afternoon. Welcome. My name is Sarah Solomon. I'm a nurse and student at Austin Peay State University. I've been a member of the community for about 5 years now, and I've lived in Nashville my entire life, so one of the rare unicorns. This community is near and dear to my heart for that reason, and I'm here to talk about heart disease today. The reason heart disease is important for our community to understand is because it is actually the leading cause of death in Antioch, and our averages of death are higher than the national average. 372 people of 100,000 will die each year annually in Antioch of heart disease. Heart disease is the leading cause of death for both men and women. It affects both equally, and more people die from cardiovascular disease than any other cause. That's in the entire United States. Cardiovascular disease is actually a group of diseases, including peripheral artery disease, coronary artery disease, rheumatic heart disease, congenital heart disease, deep vein thrombosis, and pulmonary embolism. The reason that this is so important for our community to understand is our community is comprised of 35% of Black Americans, 42% whites, and 17% Hispanics. The Black population actually has an increased risk by 33% of developing heart disease. This is due to a multitude of factors, but more increased risk for obesity and hypertension are the main reasons for this. Heart disease costs the U.S. about $315 billion annually in healthcare costs, loss of productivity, and medications. And almost half of Americans exhibit at least one of the key risk factors for developing heart disease. So this is one of those things that is very, we have the ability to prevent. It's just understanding better. So the nursing diagnosis I came up with that is actually deficient knowledge in cardiovascular disease self-care. This is related to not understanding, risk factors and what we can do to stop it before it starts. I created 3 SMART goals to address this issue, and those are: community will be able to state modifiable risk factors for hypertension and return demonstration on how to take own blood pressure by the end of the session. Group will be able to state 3 reasons for smoking cessation by the end of the session, and patients will be able to develop food plan and state appropriate food choices to decrease risk of cardiovascular disease. The modifiable risk factors for hypertension are being overweight, inactivity, tobacco use, stress, alcohol, diabetes, too much sodium in your diet, and then too little potassium can also cause this. And so those are just really important things that you can be aware of because those are all controllable, whether, diabetes be by diet, medications, insulin, whatever you need to be able to control that. Physical activity and obesity kind of go hand in hand with diet as well. And so I wanted to really focus in on diet. American Heart Association recommends a balanced diet of fruits and vegetables, decreasing your red meat intake. You want to eat a variety of grain products and mix it up, eat fish at least twice a week. And then again, too much sodium can cause hypertension, so you want to keep that at about 2 teaspoons or 2,000 milligrams. And then alcohol consumption, decrease your alcohol consumption or don't drink at all. That increases your risk for hypertension. Smoking is a really large cause for hypertension and development of cardiovascular disease. And it doesn't just affect your heart, but it affects a lot of body systems. Those 3 risk factors, I wanted everyone to be able to state 3 reasons for smoking cessation. And those are personal reasons. Those are not reasons that I can tell you in yourself, whether that be, family members are affected or you're not able to breathe properly. But I can tell you the benefits. Within 20 minutes from smoking, your heart rate decreases and blood pressure decreases. After 2 weeks, your lungs work better and your risk of heart attack drops. And then after 1 year, your risk of heart disease shrinks in half, which is pretty incredible. It's not ever too late to quit smoking, no matter what age you are. The other goal that I wanted was to be able for you all to be able to take your own blood pressure. It's really important if you have risk factors for hypertension or currently have hypertension that you're able to own your own blood pressure cuff, but also be able to take it properly and have a log. There's lots of free logs online that you're able to access, but you want to make sure that your arm is clear. There's no clothing over your arm. You can get an automated blood pressure cuff at CVS, Walgreens, Walmart, Target. Tons of different options for you available. Amazon Prime has it as well. But you want to put that on your arm. You press a button, it'll turn on and take it for you. And then you can record it however works best for you. But you want your feet uncrossed. You want them firm on the ground. And don't be really talking to anyone. Try to do it in a peaceful environment as much as you can. There's some interventions that I have come up with to decrease these issues, and that is number one, to help patients at risk find a primary care provider. I know that in Antioch it can be a little bit hard to find good health care at an affordable cost. And so on this slide previously, I've got a few different options for you, but www.freeclinics.com. You type that in, you go in and you put Antioch 37013, and it'll actually list all the healthcare availability for low cost and or no cost in the area. I think there's about 10 that I saw, which was really cool. Another one is to initiate community incentivization program to increase the cutback of tobacco. And I just am hoping to partner up with healthcare and decrease the cost for individuals who just choose to do this program. And then, if you choose to quit and you refer other people, you get more points equaling a greater discount. And then the third, but not last, park and shred. I got this idea from the Gladiator, who has a lot of different workout programs that come to parks and parking lots. And I wanted to partner with gyms and have weekly workouts for free for the community so that gym owners and things like that can produce more results for them by having their names out there and doing business cards and stuff like that. And then, I really appreciate y'all's time. If you have any questions, I'll be available at the end.